Hello, welcome to the Residential Mental Health Data Mini Webinar. My name is Erin Yarbrough Christian, Non-Traditional Educational Programs Manager for the Division of Federal Programs and Oversight. On the screen, you will see the department's Best for All strategic plan. Today's agenda will consist of residential mental health placements, funding and billing, scenarios, student classifications, research queries, suggestions to improve data quality, and then we will share our contact information. First, let's start with residential mental health placements. Legislation for residential mental health placements consists of TCA 49.3.370 and Tennessee SBE Rule 05200120. K student classification. The K residential mental health student classification that flags certain residential mental health placements inside Tennessee was retired at the end of the 21-22 school year. We will now use K in and K out. As of the 22-23 school year, last year, 2 new residential mental health student classifications are used. KN for in-state residential mental health placements and K out for out-of-state residential mental health placements. You will code all students with residential mental health placements with either the KN or the K out student classification, even those that do not meet the funding requirements discussed below. Attendance, membership, course schedules, and assessments. Students coded with the K in and K out student classifications are considered present and are not coded as absent. They are included in average daily membership, ADM, and average daily attendance, ADA, and they retain the course schedules codes that existed prior to their placements in the residential mental health facility. For information related to statewide assessments for students coded with Juvenile Detention Center student classifications, please see the accountability protocol. Next, we will talk about funding and billing. A local education agency, or LEA, allocates funding in an amount equal to the per pupil state and local funds received by the LEA on a prorated daily basis if statutory requirements are met. Payment amounts are the same for K in and K out placements. Funding requirements differ for in-state and out-of-state placements. Only remit payments for placements that meet statutory and related requirements. Facilities bill the LEA directly for instructional days that fall within the LEA calendar. Funding in-state residential mental health placements. LEAs code all in-state residential mental health placements as KN. LEAs then reimburse at the daily rate set by the department's finance team for instructional days for in-state residential mental health placements that meet the following conditions. A general education or special education student is placed through a signed written physician's order based on medical necessity. The student is enrolled in the LEA and was enrolled in the LEA in the school year prior to the admission, and the facility operates an approved Category 1 special purpose school. Funding for out-of-state residential mental health placements. LEAs code all out-of-state residential mental health placements as K-out. LEAs reimburse facilities at the daily rate set by the department's finance team for instructional days for out-of-state residential mental health placements that meet the following conditions. A special education student is placed through a signed written physician's order based on medical necessity. The student has an active IEP at the time of the placement decision. The student is enrolled in a public school in Tennessee when admitted to the out-of-state facility. The student was enrolled in a public school in Tennessee for the full school year that preceded the student's admission to the out-of-state facility. There were no facilities in Tennessee able to provide the appropriate mental health services for the student when the student was admitted to the out-of-state facility. The facility has been approved by the department to receive prorated LEA per pupil state and local funds for placement through an application process with requirements that encompass location, health and safety, educational services, teacher licensure, and other factors required by state law and State Board of Education rules. The facility has submitted all required documentation for the placement via the out-of-state residential mental health application and e-plan, and the department has approved LEA payments to the facility for the placement. Application and approval site for out-of-state placements. The application and approval site for out-of-state residential mental health placements is in e-plan. For additional information, you can contact Aaron Christian, that's me, at the Department of Ed. Now let's look at some scenarios. Scenario 1. Julie is a student attending Greene County High School and is placed by a physician for treatment at a residential mental health facility in Tennessee. The facility operates an approved Category 1 special purpose school, and Julie was enrolled in the LEA in the prior year. How will Greene County code Julie in Student Information System, or EIS? That's correct. Greene County will code Julie with the KN student classification because she was placed by physician's order in an in-state residential mental health facility with an approved Category 1 special purpose school. The facility will bill the LEA directly for the days that educational services are provided. Scenario 2. Bob is a student with an educational disability and is attending high school in Tennessee. He is placed by a physician for treatment at an residential mental health facility in Georgia. Tennessee has not approved any treatment facilities in Georgia. How will the LEA code Bob in SIS or EIS? That's correct. The LEA will code Bob with the K-out student classification since the residential mental health facility is out of state. However, the LEA will not pay invoices from the facility because it has not been approved. Now let's take a minute to look at student classifications research queries. To check your data in EIS, log in as a district or school user. Select Data Reports, Research Queries. Select the Student Classifications Research Query. Select Student Classifications and the Residential Mental Health Student Classification of Interest. For example, select In-State Residential Mental Health Placements, KN, for students with in-state residential mental health placements. Year pre-populates as 2023 for the 2023-24 school year. Student classifications research query results. In-state residential mental health placements for KN. To run the query, select View Report. To download in CSV or Excel format, use the file icon to the right of Find Next. The research query results include a record for each student flagged with the KN student classification. School and student identifiers are on the left. The KN student classification is on the right. Next, we have a few suggestions to improve data quality. Regularly collaborate with attendance, EIS, federal programs, and other colleagues to ensure that your data are coded properly. Frequently check your data in SIS and EIS and upload revisions as needed. For additional information, please refer to the FPO Data Manual. Next, we will share some contact information. For questions about residential mental health programs and coding, please contact myself, Erin Christian, NET Manager at erin.christian@tn.gov. For questions about residential mental health data and coding, please contact Trish Kelly, FPO Data Manager at trish.kelly@tn.gov. For EIS questions and restaging problems, please contact the District Technology Support Team at dt.support@tn.gov. Thank you for viewing the presentation today. And please contact the number on your screen if you feel that there was any fraud, waste, or abuse. Thank you.